And then we have the radial nerve, and the radial nerve will originate from the posterior cord, as we know, and the radial nerve will have a course that looks something like this. First, it perforates the medial intermuscular septum on the medial side, and it goes through something which is called the radial groove on the posterior side of the humerus, and then it perforates the lateral intermuscular septum, and it becomes anterior again, and it goes all the way like this till it reaches the lateral bicipital groove, and then it gives two branches. The deep branch, which goes behind the radius like this, and it goes all the way through the middle, and the superficial branch will go all the way on the radial side, and when it comes to the wrist, it will go posterior again to innervate the dorsal part of the hand, the skin. So this is the radial nerve. From this we conclude that the radial nerve will give muscular branches, and these will be for the posterior compartment of the arm, the triceps and the anconus muscles, the radial nerve. So it provides muscular branches for such muscles. Also, it gives the posterior brachial cutaneous branch. So it innervates the skin of the posterior aspect of the arm. Then we have muscular branches for the posterior compartment of the forearm, the extensors. So they're supplied by the radial nerve. And similarly, we have a posterior antebrachial cutaneous branch for the skin of the posterior aspect of the forearm. And the superficial branch and the deep branch. The superficial branch will go like this, as we said, and it passes through the anatomical, or it passes near the anatomical snuff box. And we have the deep, which is coursing posteriorly, and after innervating the extensors, it actually transforms into something called the dorsal interosseous nerve. The dorsal interosseous nerve. So this is the dorsal interosseous nerve. This is for the radial nerve. The ulnar nerve. The ulnar nerve is most medial, and so it will also perforate the medial intermuscular septum, but below the radial nerve, and it will go posteriorly. It will go behind the medial epicondyle of the humerus, and then it will go anteriorly again, all on the ulnar side, and when it reaches the wrist, it will give branches. So the ulnar nerve gives muscular branches for the muscles which are not innervated by the median nerve. So the ulnar nerve will give branches for the flexor carpi ulnaris and the medial side, or the ulnar side, of the flexor digitorum profundus. The ulnar nerve will give palmar branches and deep branches, superficial and dorsal. So palmar and dorsal and deep and superficial branches, in order to innervate the skin and the skin and some muscles in the hand. So this is the ulnar nerve. For the musculocutaneous nerve, it's most lateral, and it goes all the way like this. And on the lateral side of the humerus, the lateral epicondyle, it branches and it continues as the lateral antebrachial cutaneous. The lateral antebrachial cutaneous to supply the skin of the lateral aspect of the forearm. Also, the musculocutaneous nerve will give muscular branches for the anterior compartment of the arm, like biceps brachialis, coracobrachialis, and so on. So these are the branches of the terminal branches of the brachial plexus. For the hand, the innervation of the hand has a pattern like this. So this will be the right hand, this is the dorsal side, and this is the palmar side of the right hand. So for the dorsal side, actually the median nerve supplies innervation for the last knuckles, the skin of the last knuckles of the index, middle finger and ring finger, half of the ring finger actually, just half of it, is innervated by the median nerve. So the median nerve is in red. And for the rest, we can divide it this way. So this side is innervated by the radial nerve, and this side is innervated by the ulnar nerve. So the ulnar nerve supplies 2.5 digits and the rest of the skin in this portion, and the radial nerve 2.5 digits and the rest of the skin on this portion. If we go to the palmar side, for the radial nerve supplying this region, including the thumb, it would also take this part, a little portion here in the tenury region. This is supplied by the radial nerve, and for the rest of the palm of the hand, we can divide it this way. So the ulnar nerve supplies 1.5 digits, and for the rest of the palm, it's supplied by the median nerve. So this is it for the brachial plexus. Terminal branches. I hope it's clear for you, and until the next time, I thank you for watching and see you.